When you go to the dentist, what does everyone want to hear? We want to hear that we don't have any cavities and that we're doing a great job brushing. We may not really think about it, but we want our dentist to say positive things and be proud of us, children and adults both. So how are cavities formed and how can we avoid them? Our mouths have bacteria all over them. Some bacteria is good, but there is also bad bacteria. NIDCR says that there is constantly a game of tug-of-war going on in your mouth. Bacteria and sugars on one side, battling against saliva and fluoride. Today, I'm going to go through how we can help saliva and fluoride win that battle and slow down or stop cavities in our mouth. I will talk about how we should be brushing our teeth, how gross our teeth are when we don't brush, and what happens when we don't brush. I am here to convince all of you to brush your teeth and keep them clean. I know we are told to brush from the time we were little kids. So many take it so lightly, but it's our health that's at risk. Teeth are strong, but they need to be taken care of. Alan Carr, DMD, says, when you brush, you are helping remove the food and plaque on them. The Mayo Clinic states that plaque is a sticky film that forms on our teeth and contains bacteria. Carr reminds us that when plaque is not removed, it can harden and become tartar. This makes cleaning your teeth more difficult. Carr wants us to also consider our diet when thinking about our teeth. If you have eaten acidic foods or beverages, so pop, even milk's acidic, all of the acidic foods, they recommend to wait to brush your teeth for 30 minutes because the acids on your teeth weaken the enamel, and when you brush, it can quickly remove the enamel. Enamel is the thing that's protecting your teeth, so you do not want to remove that. The American Dental Association, also known as ADA, recommends you brush your teeth twice a day with a soft bristle toothbrush. Anything more than a soft bristle toothbrush is going to be hard on your teeth, and it's actually going to cause more issues than being helpful. You don't need anything super rough to remove plaque as long as you're brushing that twice a day for the 2-minute time. The hard one is going to start causing your gums to recede and your enamel to start wearing off. The size of your toothbrush is also very important, and it needs to be able to fit in your mouth and fit all the way to the back of your mouth. The American Dental Association also recommends that you change your toothbrush every 3 to 4 months, even though you only go to the dentist 6 months, and you get a new toothbrush, then you should be changing it more often than that. And you also need to change it every time you're done being sick, because that bacteria from when you're sick is just staying on there, and you're just spreading that bacteria around. You're not really helping yourself. The proper way to brush is at a 45-degree angle towards your gums, gently moving the brush in circular motions and going back and forth. Make sure you're brushing the outer surface, the inner surface, and the occlusal surface, which is your biting surface. Also remember to brush your tongue and remove the bacteria from there, because that's what's going to cause you a stinky breath, not your teeth. If you just clean your teeth, you're not getting rid of your stinky breath. It's all on the tongue. ADA recommends you brush for 2 minutes twice a day because they say that the mouth is a gateway to a person's overall health. And an unhealthy mouth can be associated with obesity, diabetes, and even heart disease. There are many people who get home late at night and are so sleepy they feel like not brushing their teeth just for that night. When you don't brush your teeth, your mouth is filthy. When you skip brushing your teeth just one time, you are beginning the growth of decay, according to Huffington Post. Brushing displaces that bacteria, and when left, it starts attacking, says Depinder Sohat DDS. This will affect your teeth, but it will also begin to affect your gum tissue. We also need to remember gums, mints, and mouthwash are not a replacement for brushing your teeth. Having a cavity doesn't seem so bad, but according to Sarah Elliott on How Stuff Works, she tells us not brushing can also lead to gingivitis and periodontal disease. Gingivitis is inflammation of the gum tissue, and periodontal disease It's basically when you start losing the structure around that tooth, and that's the #1 reason for tooth loss in America. And that's according to Modern Dental Assisting Book. I know people get busy, but I also know people care about their health. I challenge everyone to brush twice a day for just that 2 minutes. Total of 4 minutes a day is all you need. If I haven't convinced you, let me show you a few things. So I'm going to kind of explain. This is a tooth. The pink inside of it is your pulp. The yellow is your dentin. Orange is enamel, and then there's a blue line right around it. That's your cementum. So the strongest of all of this is going to be your enamel right on top. So that's going to fight off a lot of things, but that's where the decay is going to start. Once it gets through that enamel, it gets to the dentin. Dentin is a little bit weaker than enamel, so it's going to start traveling faster through that dentin. And then once you hit that pulp, that's where the root canals come in and all of that, because when a dentist is trying to remove that cavity, they hit the pulp, that's where all your nerves are, gets really sensitive, and it dies on you. So you want to continue going to the dentist because they're going to catch that decay early enough so that it doesn't get to that point. The periodontal disease is going to be, you have PDL around it. So that's basically what's holding your tooth in place. It's what helps move teeth when you're doing orthodontics or any of that. And then you also have your bone around that. And when you have periodontal disease, basically it's recession of the bone and your bone starts to recede. That's what's holding the tooth in place, and that's why the teeth come out. I also have a few pictures that you guys can pass around. This first one, sometimes when little kids go to the dentist, they get little disclosing tablets. So they're like little purple tablets. You can chew on it and see where you haven't been brushing very well. Well, you can do that anytime pretty much. You can ask your dentist for those, and you can go try them at home and see how well you're brushing. But this is just a picture of someone who chewed on one of those disclosing tablets, and it's all around the gum tissue, and that's when they don't go at that 45-degree angle towards the gums. And then here's a few pictures of different cavities. I'm going to just pass that one around, and there's arrows pointing to where the cavities are, but you can kind of see basically just eats away at your tooth, and it eventually goes away. And then this is periodontal disease. It's just the gum tissue receding, and you can kind of look at that too. That's on the lingual surface, so the side closest to your tongue. And then I'm talking about brushing your teeth and about how to brush your teeth, but with an electric toothbrush, it's a little bit different. There are different types of electric toothbrushes. This first one is going to go side to side. It's an oscillation toothbrush, so side to side. This bottom one's going to go in a circular motion. And then this one right in the middle is going to do both of those things. That's the recommended electric toothbrush. If you ever are looking for a new one, that's the kind you should get, the one that goes side to side and in a circular motion. We all need to brush our teeth because without brushing, it will lead to that plaque buildup and cavities. I hope I have convinced all of you today to keep on brushing twice a day for at least 2 minutes. Then I'm just going to circular this around so that my teacher believes me that I had people.